Hello, I'm Harold Munro, editor-in-chief at the Vancouver Sun, joined by Katie De Rosa, our bureau chief for the Sun in the province in Victoria. Hi, Katie.
Morning, Harold.
Hey, you spent the better part of last week trying to peel back the layers on this question of illicit drug use in BC hospitals. I guess the first question I'd have is why is this issue surfacing now?
Well, so there was a last week that BC United had obtained a memo from Northern Health. It was from last July, and it was basically telling nurses at a Quesnel hospital that because of the drug decriminalization policy brought in by the NDP, that nurses are no longer able to seize people's drugs. And they also said do not seize weapons, including knives less than 4 inches. I mean, I think that was a shock to a lot of people that nurses
Right.
would. And they even said, do not call security or the RCMP unless it's a big weapon, I suppose, or there's someone has a gunshot wound and they've come into hospital. So I think a lot of people were shocked at the kind of acceptance of illicit drugs in hospitals. And when I started talking to nurses, it got out that it was not even just people possessing drugs, but people were using are using illicit drugs in their rooms, in the bathrooms adjacent to their rooms. And a lot of it is smokable substances, fentanyl and meth. And so the consequence of this is that nurses are inhaling illicit drug smoke, and it's become a safety issue. I mean, I talked to about 6 nurses last week, all anonymously because they could face repercussions. They're not allowed to speak to the media under the health authority policy, but they were saying that there's a case where a nurse who recently returned from maternity leave had walked through a cloud of fentanyl smoke, and she was told to not breastfeed her baby as a precaution. There's other nurses who filed WorkSafe claims because of the health impacts they felt. And so, the more we write about this, the more nurses are coming forward to say these are the conditions I'm facing, and I feel unsafe. You never know if you open a bathroom door, if someone's inside and they need help, what you're walking into. So the nurses are saying, well, do I have to wear a respirator at all times? And so these are some really big issues, not just in Northern Health, but across the province.
Right. And I would imagine that it would be, I mean, it's the nurses that are on the front lines of this, but fellow patients as well potentially could be exposed to
Yes,
this.
I talked to nurses who said, sometimes there are shared rooms. A nurse in Burnaby Hospital said there was an incident where two elderly women were sharing a room with a gentleman who had consumed street drugs and was acting very erratically. He was naked, and the women were very afraid of just his behaviors. And so definitely exposure for patients as well. And I think we've seen how widespread this is through a glimpse of it through a WorkSafe report that I obtained last week that showed WorkSafe inspected sites in Campbell River Hospital, Victoria General, Royal Jubilee Hospital, and several community health sites, all to look at whether Island Health was following proper protocols. And it found a lot of cases where Island Health was not, wasn't giving enough training to staff on what to do. So again, that example of, well, how should staff know when to keep themselves safe? On the lack of training. And so Island Health has responded. They said that since that WorkSafe report, they have fixed all the problems and did everything the WorkSafe report asked them to do. But the reality is that hasn't stopped people from smoking drugs. And I will add, Health Minister Adrian Dix said last week, people are not allowed to smoke anything inside hospitals. They are supposed to either go to an outside smoking area, or some hospitals have adjacent safe consumption sites. So, smoking is not allowed, but the reality is people are breaking that rule, and it's putting nurses at risk.
Hmm. But even going outside to a smoking area, you're going to be smoking crack next to somebody who is smoking cigarettes and
Yeah.
blowing smoke. Anyways, it's it's complicated. Well, but is there a solution? I mean, can you simply take the drugs away from people when they
Well,
saying that they can't have them because they're being treated with other potential drugs that could have, I guess, react to those drugs, or like what is the solution?
I mean, so according to the BC United, they say that this is another consequence of the decriminalization policy brought out by the NDP. They're saying that the scale has tipped too far in the favor of people who use drugs, and it's putting other people who don't use drugs at risk. And so, the BC United are saying, again, here's another example of the failed decriminalization policy. The BC government disputes that. Minister of Mental Health and Addictions Jennifer Whiteside said, taking away, reversing the decriminalization policy will not save a single life. However, we have seen in Oregon an early adopter of decriminalization. 3 years after, they have completely taken it about face. The mayor of Portland has come out and said, this is a failed policy. This did not work. We got it wrong. So we are seeing other jurisdictions walk back. And so, I don't know what the next steps will be. We have a 3-year pilot here in BC, but certainly the pressure is building. And you're right about sort of the impacts of individuals' medication, because when I talked to some nurses, they said they were worried about if someone took illicit drugs but weren't completely open with what they took. They're worried about, well, okay, well, if I give them morphine, if I give them a medication, how is that going to impact their body, and will I be liable if they overdose? So, I mean, again, these are conditions that nurses are under. There's a constant stress. Hospitals are already overcrowded, and this is another thing that they're dealing with. So, I really don't think this is going away, and it's just one more pressure on the government to defend the decriminalization policy.
Hmm. You mentioned Oregon, and reading some of the comments by the mayor, he wasn't necessarily against decriminalization, but he felt that it kind of done it backwards in Oregon. They didn't have the proper treatment and recovery, enough of a robust regime around that before they decriminalized. And you hear people from the BC United and elsewhere, even advocates, say that that's sort of where BC's at as well. Like, we just don't have enough resources for people who want to get off of drugs.
Yeah, I mean, there was the recent announcement by the government of a certain number of completely free beds. I think it was like 120 free beds, but a lot of people are saying, why make some beds free but others not? It's almost creating a three-tiered system of, some
Right.
beds are completely free, other beds are subsidized to, $30 a day, and other private beds are, hundreds of dollars a day, and still people are not able to get into treatment if they want. So I think the argument is that BC has completely put the eggs in the basket of harm reduction and not focused at all on treatment, or not focused enough on treatment. And that so again, in Alberta, Eleanor Sturco from BC United has really pointed to Alberta, that they have sort of an online system where if you're asking for treatment, it's a faster way to get into the treatment program, also access the harm reduction supplies that you need, but you know that you have a pathway to treatment a lot faster. So I think that criticism is valid about not putting enough focus on treatment, and certainly it feels like the two sides, like harm reduction and treatment, are just, it's like they're not talking to each other. It's like you either believe in harm reduction. I feel like there needs to be that larger holistic approach, having sort of harm reduction, of course, to stop people from dying, but the longer term stream being eventually having treatment as a solution to get people off illicit substances.
Right. And that's the more difficult and more expensive piece of all of this, isn't it, Katie? We know that it can take many attempts at recovery before someone can get off drugs, if they
Yeah.
ever are successful. And that's very expensive and very time consuming. We don't seem to have the supports at the front end, and arguably we don't have much in the way of supports at the back end either. When someone does manage to get off drugs, like the supports to make sure that they can stay clean, that they can get integrated back into society. Again, these are all things that we talk about, but neither the federal government nor provincial governments going back many decades have stepped up in that
Yeah.
regard.
I mean, even so, a really fierce advocate, Guy Felicella, who has his personal experience with both, harm reduction and treatment. He recently said he was supposed to, I saw on Twitter, he was supposed to speak at a conference that was focused on recovery, and they were found out that he was also advocating for harm reduction, and they disinvited him. And that said that was an example of, again, the
Hmm.
two sides being so polar opposite, there can't even be a conversation. And so, because a guy is he's an advocate for whatever is best for that individual. So some people might, benefit from harm reduction, and then a longer term plan on, methadone or Suboxone. But then other people would benefit from treatment. So I thought that was quite a stark example
Hmm.
of where the two sides will not really even engage, whereas he's someone who sees the value of both those approaches. So I thought that was a really powerful example. So
Well, that's interesting where the different politically where people sit. Remind me again, where did the Liberals turn BC United? I thought they actually supported decriminalization when it came through.
well, and I mean that's something the government is saying to them, is they said you voted for this when the policy came into place. But think what Kevin Falcon is saying now is, you brought this in with no guardrails. We said we support decriminalization with a more robust treatment option. So that's how Kevin Falcon is kind of dancing around this, I suppose, is basically saying that you've completely, they don't have any, you don't have any guardrails. There's no treatment options, and so that's why the system has, or the whole experiment has failed. And but again, that's the argument from the BC NDP is, well, you supported this, now you're flip flopping. So yeah, a
Okay,
bit of politics there for sure, but
right.
certainly
So what does BC United want to see? Do they want to pause decriminalization and get on with rehabilitation and treatment? Or
Yes, yes, they have said we need to stop the decriminalization experiment until we have sort of the holistic system of treatment. And so that's what they're saying, is that basically they need to end decriminalization. And I don't know if they would say let's start it again. Probably not, after they've, some of these examples. But yeah, so they're saying they want to see the end to the decriminalization pilot project.
and where do the BC Conservatives and John Rustad stand on this?
They would be for sure, saying end decriminalization. When John Rustad announced his candidate, Gwen O'Mahony, last week, actually a former BC NDP MLA, very
Right.
shortly, 1 year, from 2012 to 2013. She said that she has relatives, a nephew of hers, who have struggled with addiction, and she had an anecdote where she said her nephew was in hospital for an unrelated medical incident. He was in a coma and actually went through withdrawals during that coma. And she said that when he woke up, the doctors were going to give him, I think it was methadone. And he said, well, no, I've gone through the withdrawals. Like I don't need it. Like I want to. So he felt like it was harder to take the abstinence route than
Hmm.
it was to take the harm reduction route. So that was sort of an anecdote that she gave that said the government has focused too much on harm reduction and not enough on treatment and recovery. So yeah, the BC Conservatives would be, although they haven't released their mental health and addictions plan, BC United, had their plan of, $500 million investment on. Or maybe it was a billion. The numbers are escaping me now, but so we don't really know the BC Conservatives, like what they would do instead.
Okay. Well, we've got a few months until the election, so we'll definitely keep an eye out for all of their platform
Yeah.
positions on this and more. All right. Thank you, Katie. Appreciate it.
Thanks a lot. Good to chat.